Johnson, the man from the cool hills of Mandeville. He has just joined us. How are you, Doc? Hope you've been having a great day so far.
Thank you very much, Vernon. I'm fine, thank you. I'm just giving thanks being alive. How are you?
You know, can you imagine if all of us should start doing that, giving thanks for just being alive? But I guess
Exactly.
because we are alive, we are able to complain about any and everything.
That is
I'm still fighting
that
on
is
my
true,
brother.
Vernon. That is
Only a
very,
dead
very
man
true.
can fight.
That is true. That is true, Vernon. That is true. And Vernon, we are living in very interesting times,
You you
and
can say that again.
you see, Vernon, you see, I am understanding that little by little that the policies of one set of nation
Yes,
one set of nations can affect others,
the whole world.
irrespective of how far or near that those countries are.
Hmm.
And part of the networking of those policies that tends to be affected is also healthcare. And I've been following recent news or trends in the news where the some of the sweeping changes that the United States government are now introducing, that can have direct and indirect effect on us, and that is really funding towards the United States Agency for International Development, or USAID.
Yes, yes.
And many of our listeners need to understand how important that set of monies are. And it's not only for Jamaica, but it's a real global
Hmm.
concern. I'm sure when we follow the news that United States is the largest donor of this agency,
And to
and
WHO.
and to WHO.
Yes.
And just as a backdrop here, that the USAID was actually formulated back in the early 60s. I think it was 1961 by the
Hmm.
then President Kennedy.
Right.
It was multifaceted. It was a soft approach in gaining power over the Soviet Union at that time,
Yes,
where they
yes.
would give assistance to certain developing countries,
Right, right.
you know, to assist in their economy, the infrastructure, and also in their healthcare as well. And that in itself would give America footage in that country to initiate certain policies that is friendly towards the American scope. And this now, for us, we have seen how it is that it is very important in our healthcare system. And we see how it is that it has funded a lot of our, well, quite some of our major, major healthcare problems, notably that of HIV. And it's not only HIV, but also tuberculosis. And, they're also helpful in other countries where you have, if it necessary, to stave off the certain communicable diseases such as malaria, and
Hmm.
we are hearing about the outbreak that's happening with the Ebola virus in
In
Africa.
Africa, yeah.
Right. So all of these monies are necessary for a number of reasons. It would be used to educate personnel, to provide funding for healthcare teams, to monitor the diseases, and also for providing assistance in purchasing
Hmm.
medicine, and in cases where vaccinations are necessary, towards these vulnerable groups. Now, America, as I said, is the largest donor. I think last year, Vernon, America gave about $6 billion to the Saharan African region just last year alone, and to the International Development Fund. Uh, you know, to the USAID, it gave about $40 billion. So it's a significant sum of
Mm,
money.
mhm.
But what's happening now is that the quite a large percentage of the American public believe that the government is spending too much money on 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 issues or policies that, in their opinion, does not benefit them directly or even indirectly, especially directly.
Let me ask you
Six.
something. Sorry
Hmm.
to interrupt you. COVID started far away from this part of the world.
Yes, yes, it
Uh,
did. It
and
did.
what it did,
It
it
did.
impacted the whole world.
Exactly. Thank you
With
very much,
travel
Vernon. Hmm.
being a big thing these days,
Hmm.
the problem of a disease in one little spot becomes a
Right.
problem for every spot across the world.
Exactly, Vernon. That is the point. That is the point. So it is a way of you having vigilant surveillance and control
Yes.
over these situations or healthcare scenarios. And the one of the primary focus of USAID involvement in Jamaica is that of certain sectors that we consider vulnerable groups.
Hmm.
And you know what we are happy what we are noticing now is that um, one of the aims is funded through this program. They call it the President's Emergency Plan for AIDS Relief, where it targets these vulnerable groups. Right.
Yes.
So it provides um, professionals to come in and to give educational talks, also to make sure that there's proper following up, because it's not just to give talks, but you have persons who actually go out there to the different members of the community who are HIV diagnosed, to make sure that their medications are obtained, not just to be filled, but they and call them out to come to the various centers for evaluation. And one of the aim, Vernon, is to identify those who are positive but who do not show signs and symptoms. And once you catch that, no, there's a program whereby which the aim is to have an undetectable viral load. That is the
Hmm.
aim of the AIDS program, to identify these persons and to control them, and also their contacts as well. So without this form of monetary involvement, Vernon, and it's going to hamper the running or the mechanism of these programs in Jamaica. And we are not yet certain to what extent this will have on us. I mean, right now there's a 90-day freeze on these monies that's supposed to be sent over to fund these projects. And
Yes.
the thing is, as I said, we are not certain how far reaching this is, because 90 days is a very long period. And after the 90-day period, we are not certain if we'll go ahead and grant us or grant the money to be resurfaced or recirculated into the system.
Hmm.
And if he does, is he going to be cutting it, and by how much? So we do not know. There's a lot of questions that need to be answered, and this now can set us far back, because if you know if these programs that are supposed to help, especially with HIV, is not properly maintained, Vernon, we can have a regression whereby which persons lose medication, or even go around with unprotected sex, and therefore creating another problem on our hands. I know that the government is aware. I think the government is aware of all of these, but I would love for us as a country to start taking stock on the changing events of this world, and for us to understand that we are to, move away from this whole attitude of freeness, where we expect countries to be donating these help to us. And I think we have to start coming up to the reality that these programs can 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 may not be able to last as long as we want,
I don't want,
as
yes.
what is shown right here. So right now,
Well,
Vernon,
what we what we have to understand, is
mhm,
that, well, I always hear them talk when I was in Trelawney about every tub have to learn to stunk on your own bottom.
mhm,
But at the same time,
mhm,
if you have dinner and your neighbor
mhm,
has none,
mhm,
it probably is good for you to share some of your dinner with your neighbor.
mhm,
Because if your neighbor die from hunger and nobody to bury him, it's going to affect you too. There was a time when a community was just a few districts, surrounding
mhm,
districts. Now a community is now the whole world. And there's no such thing as independence, it's
mhm.
interdependence.
Interdependence.
So if we
Yes.
continue to think that each man is an island, then it will be an island floating on its own. And no
Mhm.
matter how you're big, after a while, you become so small that you will sink in the ocean. Enough said. Let's go for the break. When we come back, we talk some more about that. Talking with Dr. Llewellyn Johnson, the doctor from the cool hills of Mandeville, telling us about some international matters which affects health and the impact that it will have. We hope to hear from our government soon, the impact that any cutback in aid will have on Jamaica. And if we have to take from other sources, the impact that it will have on the country. This is Spot
Exactly.
On with Vernon Darby. Stay with us. We'll come back. Don't move. Yes, Doc. Back to you talking about the possible cut. Well, I know it's been suspended for the time being,
Mhm.
so things are sort of at a wait and see.
Right, right, Vernon. And this is a Vernon puts every it puts a lot of things at limbo, and we are not certain what the future holds, and even at this present moment, we're not certain how badly the operations are being affected at this time.
Yes.
And as I said before, this is going to put a number of things under scrutiny in terms of not only how it is that based on the fact that we're getting things from overseas, but we have to start becoming a bit independent and, as you rightfully said, interdependent,
Mm-hmm.
so that we can be buffered against any eventualities such as these. And Vernon, I think this is where we as a public now have to start taking our own health in our hands. We have to be responsible for activities and overall health, so that so that we minimize the burden, the financial burden on the system as it already exists. And this is why I'm thinking, and I, persons can agree and even disagree, that we start educating our young people about the importance of abstinence and waiting. And if it is that we're involved in these sexual activities, we should always wear condoms, because, Vernon, as we speak, there have a lot of persons. I wouldn't say a lot of persons, but you do have persons who are HIV positive, who are taking their medication, but their viral load is what we
Mm-hmm.
call undetectable.
And they
And
look
these
quite
folks,
healthy, right?
and they look quite healthy. And the
Mm-hmm.
worst thing about this, Vernon, is that they're having sex without protection,
Mm-hmm.
and
But
they're
my
that
understanding that even if you use a condom, the
mhm.
condom can be damaged during the.
Exactly, exactly, can be damaged. But the thing
Mm.
is, at least let there be some form of protection.
Right,
Let there be
right.
some form of concern about the responsibility with respect to your action, because this can cost the life, not really life, but the health of another individual. And so that is where we have to start putting priority now, Vernon, on the individual as well, right? Allowing that person to understand that the responsibility lies on that individual who
Mm.
has the disease, and also persons who may not have the disease, to make sure that the persons or whosoever they are engaged with use the necessary protection that needs to be, because
But
it's not as
Dr. Johnson, when you fall in love with somebody, you trust them completely. So as far as you're
right.
concerned, they're clean. They have no AIDS. They have nothing at all.
and
How
and,
you deal
and
with
that
that?
that is the problem. And
Mm.
you see that you would have to ask yourself, who do you love? Do you love yourself? Because in order to love someone, you have to love
Yes,
yourself first, and you have to protect yourself first, right?
yes,
And
yes.
if that person does not appreciate your your position in terms of you looking after yourself first, that means that person is not really for you,
Hmm.
because you need somebody to be at the same wavelength in terms of thinking, trying to make sure that the at the end of the day, because remember, the relationship does not necessarily mean that it will end well with both persons.
Yes,
Maybe
yes.
that is just for a couple of months or
Hmm.
whatsoever, but life continues.
Or
And so
days.
and even for this, thank you very much.
Yes.
So one has to start taking the necessary precautions. It has to be very, very responsible for his action or her action. And persons, as I said, are out there with the virus, and you don't know who is who, because it's not as though there's a mark that is placed on the individual's head identifying that that person is a carrier. And so, Vernon, we have to have this form of public education going out from now. I wouldn't say wait until after the 90 days expires, then we decide what we're going to do. We have to start putting it out there that persons need to be extremely responsible, because even let us say that there is no that he decides that he's not going to continue with it. That means if it is that we're going to have to fund some of these programs, the money has to be drawn from somewhere. And where is
Exactly.
that place coming from? We don't know. So that means it's going to be tight. We're in a
Hmm.
very tight fiscal situation here. And as a result of that, whatever money we can save, we try and save it, right? And as I said, we definitely have to be responsible, Vernon. And that is the cry that I'm making this afternoon, for Jamaica and Jamaicans to wake up, because the world is changing. What used to happen to us or what used to benefit us may not continue. And this is
Yes.
a big wake up call. It's not just for Jamaica, it's for the Caribbean and for the
For the
rest of the
world,
developing
yes, yes.
countries, right?
But
Right.
as I tell people,
Mm-hmm.
the I said, what's the worst? I said, even nature has its own
Mm-hmm.
penalties, and
Right.
nature's penalties are harsher than penalties that the state will have for us. So I said to
Mm-hmm.
somebody,
Mm-hmm.
when they drive on the road, what's the worst penalty you can suffer? There's no police fine, you get ticket. I said,
Mm-hmm.
no, it could be death.
Well, I think something is, well, I wouldn't say worse than it, but very, very harsh, is if that person has to be in hospital for an extended period,
Oh yeah, listen, probably permanently. So while you're dead,
or
when you're dead
permanently.
and gone, you really can't regret it.
Exactly.
But
Life goes
you might
on.
have to live a life, probably being
Right.
crippled. And yet, I'm saying to you, people knowing that, they really
Mm-hmm.
don't care. And that I know is putting a real burden. The crime and the number of accidents on our roads, really putting a major dent on the country's health budget.
Vernon, you see, responsibility means that you have to accept wrongdoing, and
Yes.
the price has to be paid. You know, when I used to work in the hospital, um, and we had to attend to those persons involved in motor vehicle accidents. They get the procedure done, they get the surgeries done, and move on. And within a couple of weeks or even a couple of months, those same persons return to the ward for medical attention. Why? Because there's no there's no repercussion for their action. The only thing is that they're going to be delayed for a couple of weeks because they're in the hospital, but they're not feeling it financially. They're not feeling it from their pockets.
But
You
financial don't
made
help, you know,
something. Hmm?
because all if I told them then, and
Hmm.
it is crucial because it's a major impact on the health budget. The only way to deal with us, because some of us, we had, I used to say, your head tough. The only
Very.
way to deal with them is to remove them permanently from our streets. And if
Hmm.
they change, then you send them back to a driving school. They have to be trained before
Yes.
being accepted back. That's the only
Yes,
way
man.
to deal with it, sir.
Yes,
Just like you have
Vernon.
some hardened criminals, you need to remove them out of the society. You have some drivers, and those drivers on the road, they're just like any missiles,
Mhm.
they're deadly missiles on our road. We
Yes,
just
man.
need to
Very
take them
deadly.
off.
Very, Vernon. Right now, I know this is your health, your wealth, but part of the health has to deal with the responsibility. And
Yes.
the thing is, in situations like this now, it's these are desperate times, and I think we have to tackle tackle this whole part of our healthcare
Mm.
system with some amount of iron fist treatment. We have to fight fire with fire. We have to just call it out for what it is. There's no need for us to be prettying it up. Look, as just you mentioned something one day, that if somebody causes an accident and injured someone, that person should pay. And I'm looking at it and I say, I think I agree with you, Vernon.
Hmm.
Because some persons do not care because it's what? Because it's free, they can go ahead and repeat the same act,
Yeah, man.
right? And with this now, there's that is putting more strain on the limited resources that's in the public healthcare system, right?
And by the way,
So,
I would have a
mhm,
problem, if they are incarcerated, and they
mhm,
don't go and sit in Her Majesty's Hotel and drink Hennessy and those wonderful things. They'll be sent
mhm,
to go and plant trees in those remote areas and do something
mhm.
productive. They'd earn a little
Yes,
salary, and the state would benefit from it. But right now, when we send somebody to prison, you're actually punishing the decent people because we have to pay for their upkeep and everything. They can't go to get treatment, and
yes,
sometimes we can't get to see the doctor.
right. Because prison is not a place where people fear. It's a
No, no,
place
no. Them
just
listen, man.
to pass the time,
And when you go to
right?
prison, you're bad, man. It shows you're bad.
Exactly.
I got prison
You
three, four
see,
times already, So
look
I'm tell
here,
you.
let it be, you see, that
Yes.
these prisoners, if it is that they had to be chained up and carried out in the town to do hard labor in the boiling sun,
Yes,
right?
man. Oh,
You
by the way,
think
you don't
that
need to
people
change
would
them
want to
again,
do that?
When you have them
Mm.
tag everybody national ID, where you going to run go? You can't go
No, but
anywhere.
no, well, that can happen, but they be chained to each other so that nobody can escape. It would be harder for them to escape.
But
And
hear the
while
joke.
that is happening,
A
people
time
will
is good,
feel.
but I will tell you, so I'll be cutting you again. But the system that I envisage, you cannot escape in a computerized system where everybody is registered, because when you escape, where are you going to go? You can't
Yes.
drive, you can't go to the
Mhm.
hospital because everywhere you go be linked up. You can't get a job because if you're a fugitive, then you'll be
Mm.
locked out of the whole system. So I have a different idea as to how to run a country. We have about human rights. The first
Right.
rights I have is to live in a peaceful country where there's less crime. So that's my
Exactly.
first right. So I tell me
Exactly.
about human rights and privacy. I will say absolute nonsense. Right now, me have to lock up in a house like me at the prisoner. Right? And criminal there
Exactly.
would walk up on the boat.
Hmm.
Anyway, but we get off on that one.
Well, you're
And also,
speaking your mind,
the final
Vernon.
point you want to make, and just tell us how we can make contact with you, Dr. Llewellyn
Yes,
Johnson.
Vernon. I'm just reiterating the point. We need to take full responsibility for our action,
Mhm.
and we should not leave it entirely on the government or a system that we consider free to take care of our problems. All right. Now I can be reached at this telephone number 5890608 or 7911090. I'm located at the Consolidated Health Service, which is located on 14 Caledonia Road, right here in Mandeville. Email address Lewin Johnson, Lewyn Johnson, lowercase, at hotmail.com.
Thank you very much, Dr. Llewellyn Johnson. Next week, we talk again.